in favor say aye. Division has been requested. Those who are in the chamber, please be seated, and those who are in favor of this amendment, please rise.
This is my amendment.
Please be seated, and those who are opposed, please rise.
All in favor of drug pushers?
The chair is not in doubt. The amendment is lost. Mr. McGowan, please read floor amendment 168.
Amendment 168 to House Bill 1284 by Senator Penry. Amendment reingress bill page
Senator
37
Penry.
after line.
This is the one about growing forever.
Thank you, Madam Chair. I'd move amendments 168. Members, one of the discussions that took place in the House is whether and how we tax this product. Unfortunately, addiction to marijuana isn't the only thing that's part of this bill. There's an addiction to more spending that's part of it. What this provision does is exempt individuals with cancer or HIV from paying the new sales tax requirement. As you recall from our debates earlier this year about sales tax exemptions, currently pharmaceuticals are exempt from sales tax requirements. What this amendment seeks to accomplish is to recognize that in the face of the very real abuses that Senator Romer has described well and Senator Spence as well, there is a subset of individuals who the voters made a determination should have access to this product. And for those people, it functions as the equivalent of a pharmaceutical. Again, under current laws, pharmaceuticals aren't subject to sales tax requirement. And for this narrow subset of the most chronically ill patients, legitimately in need, at least according to the Constitution, of the product, they would be exempt from the sales tax. I'd ask for an aye vote.
Senator Romer.
Thank you. And, while I'm sympathetic and clearly for those with terminal cancer and with obviously terminal immune, let's see, what do we have? Acquired AIDS syndrome. I would agree that if we did this only for terminal, Senator Penry, my concern is that you're creating a different class of taxation for those with cancer and with HIV than those who have Crohn's and chronic pain. So while I'm conflicted on this, I would agree to this if you'd be willing to change it on a cow to solely be those that are terminally ill and not those that are just being treated. So unless you make this for those that are terminal, I'm going to have to oppose it at this time.
Senator Tucktrop.
It's Nurse Tucktrop. Thank you, Madam Chair. And medical marijuana is a very, very effective drug to treat people with nausea and extreme nausea when you are going through chemotherapy. It's what a lot of patients with cancer are doing. So I would support this amendment for that reason. And also my understanding, a lot of the HIV drugs can cause nausea too, so this would also help treat the nausea. It would be an anti-nausea effect of both of those, and I just ask for an aye vote on the amendment because marijuana is very, very effective as an anti-nausea drug.
The question is the adoption. Senator Romer.
Yeah, and just the last issue, and look, I wish we had had a chance to work on this because the more I look at it, the more I might support this. One of the challenges is the best I understand, the type of chronic illness that a patient has is not on the card. So what happens now is you put a problem into the hands of every business that they don't know who they're to charge the tax to and who they're not to charge the tax to. So, Senator Penry, the problem is, how can you just ask me, because I'm looking at the faces up here, how do I know and how do I administer this? Because effectively, this probably will end the taxation of all medical marijuana, because effectively at this point, you really won't know which patients qualify and should pay the sales tax that the Attorney General said to pay and which one can't. So, if you could help me work on a third reading amendment that would put some guardrails and that the industry could implement, I'd be open to it. Right now, we really have an amendment that doesn't work with anybody that I know of, just simply because there's no way to administer it. But if you work with me, I probably can get there on third reading.
Senator Penry.
Yeah, part of talking about the various alternatives is it has to be. You have to be able to implement it. I once in the House used the word implementable, but Speaker Romanoff told me there was no such word. You have to be able to implement it. One of the challenges is if you were to say in this amendment that it's only if it's terminal, is there really a document for an individual that says conclusively you're going to die? A little crass, and I don't think so, but it is conclusive. You know, a patient could easily come in with, you know, a finding by a doctor that says I have cancer, HIV, and qualify for this exemption. The reason for these two, and Senator Carroll and I were having a conversation offline about glaucoma and chronic pain, and those are legitimate conversations too. I think what this amendment seeks to do is identify what the voters, at a minimum, thought that these, you know, really horrible, in many instances, terminal diseases should be covered, should be the medicinal marijuana should be accessible. So for that subset of the most ill, the universe that everybody agrees with, we don't charge them the 2.9% same sales tax. In the same way, we don't charge them a 2.9 sales tax for pharmaceuticals that they'd otherwise get over the counter.
But the indigent there's a provision for the indigent.
Senator Spence.
Thank you, Madam Chair. And Senator Penry, I applaud your compassion for the terminally ill, but have a lot of problems with this. Number one, exempt from taxes. It's not as if they get a free product. And in fact, if you read further in the bill, you'll see that indigent patients, in fact, whether they're terminal or whether they're just very sick and poor, have an exemption from having to pay under certain circumstances. So I don't see this as being an amendment that would add value, and I think it would be pretty hard to implement. So I would ask for a no vote.
Senator Penry.
Well, and we'll get to this later. I mean, I think one of the things that, and Senator Romer and Senator Spence have the challenge of moving a bill like this through the process, so I know the sausage making begins. But I think the whole monetary component of this is unseemly, how we're creating a revenue source off of the use of, in some instances, frankly, inappropriate drug use and using it to pay for drug rehabilitation programs. And that whole, as I look at the fiscal note and the morass of new regulations and fiscal implications and FTEs, that whole piece of this bill is something that I don't, frankly, care for. So again, the idea, you know, Senator Spence points out rightly that the indigent are already excluded from this. But what I'm trying to identify is, you know, who are the people that most of us would agree should have access to the product under the Constitution and the provisions, and not charge them the extra 3%. Just so we can pay for some other drug treatment program. I mean, I think that's where I think there's a common sense approach that's embodied in the amendment. So I'd ask for an aye vote.
Senator Romer.
Thank you. And members, I'm going to ask for a no today, and I'll work with Senator Penry over the night to try to come up with a third reading amendment. And what I might suggest, which is something that we've talked about, which is actually to give, because I'd like it cleaner to basically say that those people on SSI would be exempt from the sales tax. And that means that it would be neutral for what type of, whether they have glaucoma, Crohn's, and I think that's much easier for that community to administer who's clearly on disability and SSI, as opposed to picking the specific type of malady, because then, and this is the debate that happened in the House, there's a huge debate in the House in which they tried to put PTSD, and it may turn out, and we'll have a conversation when we get back to the bill and not the amendments, about really getting back to evidence-based medicine. And so what I don't like about this is that we're picking certain chronic illnesses to the disadvantage of others, and right now we've actually asked the Department of Health to look at the argument that was made in the House on PTSD, and so what I think we ought to do is stop talking about it in given maladies and given chronic illnesses and start talking about it, who really needs help. And I've been very clear that as soon as there's evidence-based medicine, and as soon as we can get this from being a pure, medicinal supplement to being real medicine, it ought to be tax exempt like everything else. So today I'm going to ask to say no on the Penry Amendment, and I will be working on a amendment that would effectively allow this to be equal across all of the different types of maladies, which would exempt the sales tax on those who are low income and on SSI. So I'd ask for a no amendment today.
The question is the adoption